the story of clozapine is pretty old. It was initially developed as an anesthetic by surgeons who happened to notice that it had a calming effect. And then this was back when we only had first generation or typical antipsychotics like chlorpromazine and haloperidol. Once clozapine entered the scene as a new antipsychotic, it was embraced, especially in Europe, I think before it kind of made its way to the United States. However, in this sort of initial phase of usage, it was noted that there were several deaths, I believe in Finland, in which patients on clozapine died by infection that were ultimately attributed to clozapine's effect on neutrophil counts, a phenomenon we call agranulocytosis. And so that was a turning point in which clozapine ended up not being used, especially in the United States, for a long time. Then there were some landmark studies that that were comparing clozapine to these older antipsychotics, and that was that partially derived from a recognition that these antipsychotics can only get you so far, not only in terms of treating the psychotic symptoms of schizophrenia, but also in terms of treating other types of symptoms and sort of overall functioning and quality of life. And so clozapine was sort of reconsidered, and in these landmark trials, it was shown that they were superior to other medications, and that's how it ended up getting FDA approved, with the caveat that it, uniquely among the antipsychotics that we use, clozapine does require enrollment in a registry that's called REMS. And so clozapine was the first of what we call the second generation or atypical medications. They are different from the previous generation in that they have less risk of extrapyramidal symptoms, which are some of the most common and most debilitating side effects of medications like haloperidol. And however, second generation agents like clozapine, olanzapine, others, they have their own side effects, like metabolic side effects that the first generation antipsychotics do not have as much. The interesting thing is, even though clozapine has been around for a long time, and many newer antipsychotics have been developed to sort of mimic or surpass the superior efficacy of clozapine, there is yet to be an agent that has been able to accomplish that.